Hello, everybody. My name is Dr. Vince Gutierrez. I am a physical therapist. You can find me at movementthinker.org. I practice out of the Joliet, Illinois area. This is video 4, and up to this point, sorry, I got to bring my little cheat sheet with me here. It's blank. I don't have any notes on it, but it at least helps me keep track of where I'm at. And so far, we've covered introductions, age, what do you do for a living, what do you do in your free time, what symptoms do you have? How long have they been there? Are they improving or not? Why did they start? And do they come and go, or are they always there? Today, what we're going to cover is called the better worse section. Okay, and this is a list of activities that we're going to ask patients to try to figure out what makes you better, what makes you worse, or do these activities have absolutely no effect on your back symptoms or your leg symptoms? And we'll cover it as we go along. So first question that I'm going to ask is bending forward. How does that affect your symptoms? Now, I'm just going to throw some stats out at you guys because the stats, I feel comfortable with numbers. I really like numbers. They console me, right? And so they're not intimidating. They don't need to be. It's just numbers. There's no threat here. What we know is that roughly 64% of people get better with bending backwards, and usually these patients will get worse with bending forward, right? And that's fine. There's nothing wrong with getting worse with bending forward or feeling pain when you're bending forward. It's just data. It's just information, right? And sometimes we get the patients that come in and I ask them the question, so tell me what happens to your symptoms when you bend forward. Do they increase, decrease, or stay the same? Whoa, when I bend forward, my symptoms go crazy. I can't do it. It's impossible. And the theatrics are fine, right? I mean, I'm not judging I am judging the theatrics a little bit. Let's be real. I am judging the theatrics a little bit. If you're good, it's like Oscar caliber, right? But what the theatrics tell us is that there may be some psychosocial stuff going on in here, and you're really trying to draw attention to your symptoms, which is fine, right? I mean, it's data. That's all it is to us. That's all it should be to your therapist at this point is just data, right? And we want to know if it makes your symptoms better or worse. And so if you did all the theatrics, right, it's just a yes, it makes you worse. Okay, it's not a huge deal for us, but we may put exaggerated response, something like that. What happens to your symptoms when you sit? Increase, decrease, stay the same. And really, we're going to ask a few questions along with these. If your symptoms increase, where do they increase? Do they increase in your back? Do they increase down your leg? Do your symptoms move at all, right? And I like to ask a few follow-up questions that aren't on these forms. If you're sitting, how long can you sit for before you have to get up and move around? It's a small detail, right? But it's a baseline measurement that I can go back and re-ask you the same question again in 3 to 4 weeks to see if we're having any effect on something that matters to you. If your job is sitting and you can only sit for 5 to 10 minutes, we got a problem, right? If you've got kids and you can't sit for a long period of time and you have to hold your kid on your lap, you're going to have problems, right? And so if I can get you to sit for longer periods of time, could be a functional improvement. Getting out of a chair. Does getting out of a chair change your symptoms at all? This is more of a yes or no. We don't really tell if it makes you better because it happens. It's like that, right? And with this question, we're looking to see when you go from a typically forward bent posture to a typically upright posture, sitting typically forward bent, your knees are towards your chest, you might be slouched a little bit. With standing, your knees are away from your chest, you're going to be more upright. When you transition from this forward bent posture to this upright posture, does your back like that or not? And I'm not asking you what happens when you get up there, I'm asking you what happens on the way up there. So do you have symptoms during that transition? And if the answer is yes, it leads us down a certain path. If the answer is no, well, then it doesn't really give us any details, right? It doesn't give us any data to work with to start making conclusions. The next one is standing. Do you have symptoms when you're standing for a period of time? If yes, that's again a piece of data. Many patients actually feel better when they're standing and worse when they're sitting. Some feel better when they're sitting, worse when they're standing. It's a smaller percentage, but It's there, and we know it's there, and that helps drive us into decision-making algorithms as to what type of treatment may suit you the best. And again, your therapist needs to be putting some thought into these questions to understand how to treat you. Otherwise, you get the one-size-fits-all treatment of go on the bike, go on the treadmill, step up and down on a box, maybe go do some of these bird dog thingies where one leg kicks out, one arm kicks out, maybe posterior pelvic tilt, and flatten your belly against it and pull your belly button in towards your spine. And maybe those have a place for some patients. I don't think I've asked a patient to pull their belly button into their spine in a long time, but maybe some of these things have a place. But they're definitely not for everybody. And you should be getting a program that is catered directly to you. Again, I'm trying to keep this under 7 minutes, but I'm probably going to fail today. All right, because I still have 2 more things that I got to ask. So the next one is walking. Does walking change your symptoms at all? Oh, with standing, I never finished. If standing bothers you, how long can you stand for before you have to sit down? And again, it's a baseline measurement for me to take. I take a little piece of data now and see if we've changed that data to make that standing tolerance a lot longer in 2 to 4 weeks. Walking, what does walking do to your symptoms? It either increases your symptoms, decreases your symptoms, or it can have no effect. Those are really the only 3 options that can ever happen with anything that happens in therapy. Actually, anything that you do that's trying to change something. It can either improve it, worsen it, or have no effect on it. And we need to know this information because if you're doing a lot of things at home that make it worse, but you don't pay attention to it, you don't see it, then you just keep doing them because you don't realize that there's a correlation, there's a relationship between what you're doing and what you're feeling. And that's part of our job also, is to just bring the stuff to your attention. You say it out loud and then you're like, I didn't realize I was sitting all day long and I know that makes me worse. I probably shouldn't do that, right? And so just saying it out loud might actually cue that for you, but otherwise we are going to draw that to your attention. Walking. How long can you walk for before you have to sit down if it makes you worse? If it makes you better, awesome. Does it turn off your symptoms? If it turns off your symptoms, you're going to be walking a lot for the next 2 to 3 weeks, right? There's a lot of what we do doesn't have to be hard, right? If something makes you worse and something makes you better, sometimes you just have to reduce one something and improve the other something and increase the other something, and minimize the time with this something and maximize the time with that something. This doesn't have to be rocket science, but we go to school for 7 years, so we got to sound smart, right? I'm not going to say something in the clinic, but here doesn't matter. This is all free. Lying down. Does lying down change your symptoms at all? This actually tells us a little more about how well your body responds to gravity, right? We're all facing gravity every day. If you beat gravity, you stay upright. If gravity beats you, you hit the floor, right? So we're all facing gravity. And when you're standing up, I don't know if anybody's heard that phrase, if over the course of your lifetime, you're going to lose an inch per night, right? And then you gain that inch back later. Whatever. You got gravity is trying to smush you over the course of the day. When you lay down, you're like an accordion. You slowly spring back up. Bing! But less than an inch, right? So it's so small, but does gravity play a role in your symptoms? Are you any better when you take gravity out of the equation by laying down? And if the answer is yes, does it matter what position you lay down in? Because we know that your posture changes a little bit if you go into a back laying position or a stomach laying position, or if you bring one knee way up towards your chest while you're laying on your belly and you're like that 3/4 of the way rolled. And so all of these details tell us something. So your therapist should be asking these questions. Again, your treatment depends on you. If you're not getting better, remember 3 options only. If you're not getting better over the course of 30 days, you should seek out a different provider. There is nothing wrong with that. You are not married to that provider. You might hurt your provider's feelings. I think you can live with that. If you can't, then man, come see me. I'll see you for a year. I'm kidding, of course. But the worst thing that's going to happen is you're going to hurt your provider's feelings. That's okay because the provider wasn't helping you. You might never go back to that person again. You might never see that person again. There is absolutely nothing wrong with switching providers. So I hope you learned a little bit about movements and postures and positions during this one. This is video 4, and I'll come back in a little bit with video 5. Thanks for watching.